To make the best use of our time, I'm going to ask everyone to stay on mute until it's your turn to talk. After we hear from our guest speakers, we'll have time at the end for questions and answers from the press. They can put their names and their outlets in the comment section, and we will be able to answer a few questions. So I'd like to start with Sandra. She can introduce why we're here.
Hi, good morning, everyone. Thank you for joining us. We're here this morning representing 4,000 long-term care families in Ontario, and we're here to read our demand letter to Doug Ford, asking him to take action to improve conditions in long-term care. Back on May 26th, when the Canadian Armed Forces released their report on the horrific conditions in long-term care, we all watched Premier Ford get choked up during an emotional press conference. We heard his shock over the report and his claim that his government didn't know the full extent of what these homes and what these residents were dealing with. And he promised he would take immediate action to ensure the safety of residents in homes across the province. At the time, we long-term care families were skeptical. Why? Because we had previously reached out to Doug Ford, to his Minister of Long-Term Care, and to his MPPs, detailing the very same problems that the armed forces did, sharing the atrocities we witnessed firsthand in long-term care. We told them about the severe short staffing that resulted in neglect, the sedations, the infestations, the filth, the state of disrepair of some of these homes, and it fell on deaf ears. Yet despite our skepticism and our past experiences, we gave Premier Ford the benefit of the doubt, and we gave him the chance to do right by these residents. It's now been 6 months since the release of the military report, and there have been no substantive changes in long-term care. In fact, it's worse than ever. Homes are still severely understaffed and are still lacking the supplies that staff need to keep themselves and residents safe. And we're already in the process of seeing a repeat of the devastation that hit long-term care during the first wave of COVID. Many families are locked out again. We're slowly watching our loved ones decline through a pane of glass, watching them suffer from both isolation and neglect because there's not enough staff, watching them die of preventable causes. There's no excuse for it. The most recent numbers released by the Ontario Health Coalition show that we currently have over 100 long-term care homes in active COVID outbreak. Of those, 34 outbreaks include more than 10 staff and residents, and 29 outbreaks include more than 50. And so we're here today to share our stories in public, to let Ontarians and Premier Ford know that nothing has changed and that we need immediate action. We have a brave PSW with us who'll speak about the struggles she and her coworkers face and about the exodus of staff in long-term care. We have 4 courageous family members that are here to share their experiences, hoping to open our eyes about the conditions of long-term care, both past and present. Please listen to their stories, put yourselves in their shoes, and then demand change. None of this would be acceptable for our children, for ourselves, or for our pets. So why is it acceptable for the seniors in long-term care, who are the most vulnerable in our society? Premier Ford, we, the families of long-term care, are sick of broken promises, thoughts and prayers, and of your heart going out to us. We don't want any more empty words, and we want action. We want meaningful changes to take place now, not in 4 or 5 years. You work for the citizens of Ontario, all of us. That includes the 78,000 residents in long-term care and the over 100,000 frontline staff. They need your help, and please don't turn your back on them again. Thank you.
Thank you, Sandra. We'll now hear from our PSW, Amy. Go ahead, Amy.
Hello. So as you know, my name's Amy. I'm a PSW in long-term care. I'm here standing with families in support, as well as having my own demands as a unit together. So COVID is still ravaging our long-term care homes, which makes it clear to me that there are some hardcore issues which keep allowing this virus to spread, killing our beloved seniors and leaving healthcare workers across the province forever damaged physically and mentally. Sir, too many seniors have already died. Families of these seniors will never have closure. They will never forget the year 2020 when our premier let their loved ones suffer alone without the families by their side. PSWs will never forget it either. So many are running from their career.
Amy, you just hit mute. Amy, you're unmuted now. Go ahead.
Okay, I apologize. PSWs have been working shorthanded for years now. During COVID, it's only become worse. On top of the trauma of watching residents suffer and being exhausted, so many PSWs are also terrified for their own families. Often PSWs are forced to work with inadequate PPE and in unsafe conditions. We are scared that we may catch it ourselves or bring it home to our kids, our families, or to the seniors we have in our own household. All of these reasons are why so many are forced to leave the profession in such
Amy, you're not muted. You're good. Go ahead.
Oh, Lord. Okay, so all of these reasons are why so many are forced to leave this profession in search of other jobs. It's also why it's so hard for us to recruit new PSWs into this profession. So as you can see, sir, things need to be addressed. As a PSW of 4 years, I've seen the problem right from the beginning, even before the pandemic hit. Funny, right? Yes, sir. You must have seen it too. And that's before COVID. As I've written to you many times, as have other PSWs and family members I know, well, sir, despite all our efforts to help, I don't think you have a clear view of our crisis, nor do you seem to be a leader we all thought you were. We PSWs are requesting the following. As we know, the Bill 218 was passed through. I always say it's never too late to make changes. And I think you should pick that up and demolish it. These families deserve closure. Pass Bill 13 immediately. This is going to give us 4 hours of care, which is crucial. And we need that today, not 4 years from now. Increased PSW wages. I'm not going to put a number on that, but I'm sure you can. Give us full-time hours, benefits, and the tools we need to do our job safely. Give the word PSW meaning. Recruit people into programs that mass train to be able to hire into long-term care safely. So listen to us, families, long-term care home workers, past and present, the province. We are asking you to do something today. We need help now. If you doubt the severe crisis we're in, I would be more than happy to walk you through a day in the life of a long-term care worker. Your choice. The reality, straight up. I'll dedicate 12 hours of time. If you're willing, and I'll walk you through. When it's all over, I would like for you to go home and sit in your nice home and reflect on everything I've shown you. After you've walked a mile in my shoes, then maybe, just maybe, you, sir, will see the urgency to fix the broken system that you, sir, seem to have ignored up until now. Thank you.
Thank you, Amy. I'm going to pass it off to Sparky now. Sparky.
Sparky, you're on mute. Can you unmute us? There you go.
Good morning, everyone. My name is Sparky Johnson, and I'd like to start with this. Our Aunt Beverly Haynes went into long-term care in Port Hope, January 17th. cognitive, alert, aware, and responsive, with mobility as her primary issue as a long ago breast cancer survivor, 40 plus years, and was dead by February 29, 2020, 6 weeks. By what, without prejudice, I, along with countless others, will call it as we see it: failure to provide the basic necessities of life causing death. Bill 220-221, a criminal offense in our laws and country as an indictable offense if it were to happen to anyone else outside of long-term care or hospitals, yet totally dismissed by those who are paid to serve and protect as a government that seems by decades of death to continue to dismiss, sweep under the carpet, dismiss and ignore, and continue to create bills such as the most recent 218 to protect the owners and corporations rather than stand on guard for thee. They, in my countless years experience, both personally and professionally, and I'm not at all alone in this, thoughts or views, have given license to kill to corporations and their full support to line pockets of the lives off our most vulnerable, those in long-term care. Sick, sad truth and fact, more profit to be made off the sick, suffering, dying, vulnerable, than the living by doing what's right and ensuring that accountability, justice, charges, actions, and legislative changes are made. How many more deaths or blood needs to be shed or lives innocently taken or lost by all these laws being broken, yet 100% supported by both the provincial, Doug Ford, and federal, Justin Trudeau, governments, before those in power, politics, stop misallocating the Canadian funds, wake up and start acting. It is not only all of our families and others' lives being so inhumanely and inexcusably compromised and taken. It is the families who are also left having to fight, pick up the pieces, get the runaround everywhere we go for help. Total disregard by our government and others as to the total devastation and horror and impact with absolute no regard, thought, care, or concern for humanity. Cruelty and inhumanity at its worst. How many more lives have to be lost? When is enough going to be enough? We demand action to be heard for this government, both provincial and federal, to step up to the plate and actually do what should have been done over the decades. Stand on guard for thee, serve and protect, allocate the funds for best care possible and not for profit. Shut these houses of horror down, adhere to the Canadian laws. Our government and others need to wake up, stand up, and get real. Do what needs to be done. We will not stand down. We will not go away. We will not be silenced. We will be heard. Stop the human genocide. You have this power. You have our money. Now make this happen. We're not asking. We're demanding. Let our families in to see their loved ones. Accountability, compassion, quality of life, respect, dignity, care, with all that it is needed. Step up to the plate, people. Step up to the plate, government. Do your jobs. We're looking for accountability, justice, action, legislative changes, charges. Do what needs to be done. Be Canadian and represent this country. Stand on guard for thee and serve and protect the people. Thank you.
Well said. Thank you very much, Sparky. Our next speaker is Ellie Miller. Go ahead, Ellie.
Thanks, Jessica. Good morning, everybody. What I'm saying today is based on my own personal experience and is my own personal opinion. I'm speaking today from my mother who has Alzheimer's disease and she can no longer speak for herself. And I'm standing up for my mother today because she is too old and weak to stand up, so she is confined to her bed and her wheelchair. She lives in a care home, which has become a prison. What is her crime? She's old and vulnerable, a crime apparently in Doug Ford's government. Families are locked out, residents are locked in, no freedom of movement outside her room. Ford, Fullerton, and the rest call it protection from COVID-19. I call it emotional blackmail for families. It's a crime to keep daughters and sons and grandchildren away from their elderly loved ones who need their families as much as they need oxygen. But what about the seniors? What about keeping them safe in LTC, you may ask? When the government measures to protect them become the actual measures that are killing them from despair and loneliness, I say we have either an incompetent government or an irresponsible government with perhaps a different agenda. She's 99 now. How much time is left? How many days do I have with her? No one knows. I'm being robbed in broad daylight. My mother is being robbed. It's unconstitutional. It's a democratically elected government literally taking a hammer to the residents' charters and freedoms. I am the youngest of her 4 children, and she always said to me, Ellie, it's almost like sometimes I feel like the umbilical cord was never actually cut between us. Can you imagine how she feels now? Where is Ellie? What's happened to her? So a few weeks ago, feeling desperate on a weekend and missing her and knowing she's missing me, my husband and I decided to go see her at the long-term care home. It was more like we had to break in. They tried to stop us, front desk, cautioned us about policy. Security literally put their bodies in front of us and tried to prevent us from going up to see her. I was treated like an intruder, like a criminal, like an unwelcome stranger where my mother lives. I am Doris's daughter. I am her POA. I will not be cast out like a disobedient dog into the street. The care home has responded, but maybe that's another press conference. Care homes, I believe, have become crime scenes. You want to know how it feels to be kept away from everyone you love? All you have to do is be old and vulnerable in Ontario. Ontario, open for business, closed for families. I will close off by stating the obvious. The only thing standing between all of us and death is old age. It's going to happen to all of us. Even you, Doug Ford, even you will fall to the ravages of old age and not be able to look after yourself. What will you do then? I guess you'll hire a couple of private caregivers. But what will happen when they don't show up one day, or they're sick, or they move away? Who will be there for you? Who will wipe the applesauce from your chin? Who will run to you with a glass of water when you're so thirsty? Who will stroke your brow and soothe your pain? I'll tell you who. Family. Thank you.
Thank you, Ellie. My heart breaks for you and your mom. Next up, I'd like to welcome Joanne to tell her story.
Good morning, everyone. 42 days ago, I lost my best friend, my mom, Barbara Beggs. She was 91 years old. This is she. We lost that day a wife of 68 years, a mom to 2 children, a mother-in-law, a granny to 3 grandkids she adored, an aunt, a friend to many. My mom died in a for-profit long-term care. She did not die of COVID. I do not know the cause of her death. I do know she suffered terribly, too long, and in isolation. As her power of attorney, her primary essential caregiver, I had to work too hard to advocate for her needs, for attention to her disabilities, to be bedside. Tragically, too hard to secure the adequate pain management she asked for, her only wish not to be in pain. After 11 months in long-term care, after 4 days with no pain, she died alone. My priority now is the well-being of my father within the long-term care system, the grieving spouse, suffering in his grief and declining health. They say, speak your truth even if your voice shakes. My voice shakes today, not from fear of speaking, but from grief, worry, and anger. I can deal with losing my mom and probably soon my dad. I struggle, though, to deal with the failings of the for-profit long-term care system and an irresponsible government in our province. My dad entered a for-profit long-term care late September 2019. My mom, November 2019. May you never know the anguish of seeing your mom, always independent, now vision and hearing impaired and bedbound and isolated. Seeing your mom rendered quadriplegic, 100% dependent on staff, having lost the use of her hands, medical intervention being offered too late. Knowing she lies in a bed alone too many hours a day, waiting for even a sip of water or a blanket if cold, or a blanket pulled back if too warm. Going from daily phone calls to staff-assisted phone calls at set times of day because she can't hold the phone. Hearing her ask, "Are you angry with me?" Realizing later that she thinks you're angry because your regular visits and daily phone calls have suddenly stopped. Hearing her while waiting on a window visit, literally yelping in pain while staff tended to her bodily needs, pleading with them, "Stop, stop, please, no more, no more, please stop." Being sickened in that moment, knowing she's been suffering inadequate pain management and for how long, knowing had I been bedside, it would have been different. Having to advocate too hard with staff and a palliative consultant to secure effective pain management delivery. Being told, the problem is she can still swallow pills. We could do a butterfly feed, but the nurses would end up complaining because it's more work for them. They'd end up asking why the butterfly feed when she can still swallow. Hearing a Botox specialist tell me that her body is locked from the neck down, to hear that moving a limb even slightly is excruciating, knowing she died alone. For a resident with her degree of disability, dependence, and vulnerability, what she and our family had to endure with no bedside visitation was, in my opinion, sadistic. My only solace is that she suffers no more. May you never know the anguish of witnessing your father, 93, with heart and cognitive issues, discombobulated in his grief, struggling to even envision a future. Knowing the self-proclaimed people person sits alone for hours on end. Knowing he's regularly walking and toileting alone at risk of falls, in part because the wait time on staff assistant is just too long and too often too long. Being told and knowing that staffing levels cannot assure the one-person assist prescribed by doctors prior to LTC admission to support safety and prevent falls. Knowing he's fallen 3 times in the past couple of months, half his face black and blue, still not fully healed after 6 weeks, and he'll likely fall again. Getting 5 to 20 calls a night that he's lonely, wondering how he can live without socialization, without going crazy. To have tried repeatedly late summer to elicit a call back from management, waiting over 6 weeks to no avail. To by chance reach a manager by phone, only to learn that caregivers have been allowed in-room visits for 2 weeks, post-COVID breakout, and you'd not been advised. To know that your mother who tells you, "Oh, you're finally here. I feel so safe when you're with me. I only feel safe when you're here. You're my safety," was deprived of 2 weeks of emotional safety and comfort. To know you lost 2 precious weeks with her and time is very limited, excruciating. The for-profit long-term care system and our provincial government are failing our long-term care residents, families, and staff, overworked, understaffed, and burned out. This system of for-profit LTC serves those profiting financially. We need profound change now to stop the deaths. Answers to how this has gone so wrong. Accountability. We need full-time, highly skilled frontline staff, adequate staffing numbers. The More Than a Visitor Act now, not in 4 years. We need national standards of care in long-term care. I urge every Canadian to speak up for the long-term care community. If you've lost confidence in our provincial government, speak up, please. Call your MPPs, your MPs, ministers, the Prime Minister. Let's fix this broken system. Let's not let the deaths of our most vulnerable be in vain. Thank you.
Thank you, Joanne. That was very upsetting. I'm going to introduce, last but not least, our guest, Roseanne.
Hi, thank you for having me here today. My mother's story, she's 104. She's been in long-term care now for 7.5 years here in Ottawa. I could probably write a book on things I've seen and things I've heard, and as you all can. The horrors, the things that to us are common sense, seem to not be common sense in long-term care. The protocols in place are just that, protocols written on paper, not worth the paper they're written on, because they don't work for everybody. Everybody is different. We're all individual. My mother has been diagnosed with vascular dementia and Alzheimer's, but she's still with it enough to know that I'm not there with her. Prior to COVID, I spent 7 to 8 hours a day with her every day, 7 days a week, more than staff. Okay, she knew my touch, she knew me, she ate for me, she drank for me. What I'm seeing now and what I've seen since our lockout started March 13th is that she does not want to eat, she does not want to drink for them, she really doesn't even want them touching her. I diagnose her from outside a pane glass window, double panes. I'm watching and I'm seeing, this is not my mother. Check this, check that. I'm not a medical professional. I'm not a nurse. I'm not a PSW. But I would hope that the people on the inside would have enough common sense to think outside the box. I don't know if it's training. I know they need better training. I know they need more staff. And staffing is an issue, and it's been an issue for years, 20, 25 years. And the Ford government now has the opportunity to fix this. And he has to do it immediately. It cannot wait. It cannot wait till 24, 25, because these people are going to have a rollover in these homes of twice. You're going to lose hundreds and hundreds and hundreds of more people to things that are quite honestly, they're common sense. They're just common sense. If someone has congestive heart failure, you don't let their feet dangle off a chair. You raise their feet just to make it easier on the heart. Well, I mean, I have pushed and pushed and pushed, put a pillow under my mother's feet, tilt her chair back. I've signed off on it. It's not a restraint. The ministry has to understand what is a restraint for a climber and what is not a restraint for someone who has a medical need that needs attention, and that's the way to fix it, or to help it anyway. They have put my mother on palliative care, so that I can get in now. I get in twice a day to feed her, and it's not. Yesterday was not a good day. It was just not a good day for me. I walked home crying, sobbing actually. I know she's old, but she's my mother, and she means something to me. And she means something to our family, and she cannot be treated this way, and none of those residents in there should be treated this way. She was diagnosed with COVID on Saturday after 9 months of being free and keeping her safe. I'm hoping it was keeping her safe, but they left her in a room with a COVID positive person for almost 48 hours after having a negative test. And then on Saturday, they called me that she tested positive. So asymptomatic right now, but at 104, her chances aren't good. Really, her chances aren't good. The government has to. I'm pleading. I am heartfelt pleading with them. Make the changes now. It's imperative. We're losing more and more of these vital people. It makes no sense to me. It just makes no sense to me now. I'm just torn apart. I'm torn apart. I'm just torn apart. They have to change this. They can't close their eyes or close their ears. And Mr. Ford, with your crocodile tears and telling us how much you care and your heart goes out to us. I mean, it's just bullpucky to me now. I look at it and I want to laugh at you. I'm sorry, but I really do want to laugh. You have to make these changes. You're in a position to do it. Get it done. Our people need you. We families need you. We voted you in, and you owe it to us. The government owes us this, okay? You work for us. We don't work for you. You work for us. I'm sorry. I don't know what else to say other than, the changes have to be made immediately. They have to start doing things that are going to be vital to these people. They have to get them the proper health care. I mean, we've had doctors that wouldn't even go into the home because of COVID. So what kind of health care are they getting? They're being diagnosed by a nurse. It's unheard of, just unheard of. I had my mother at the hospital last Saturday to rehydrate her, and I'm afraid that I'm going to have to do the same thing this afternoon. So you know, like that shouldn't be something that I should be doing on the outside. It should be something that they're doing on the inside.
Well, thank you very much, Roseanne, for being brave and enough to share your story with all of us. I'm going to pass it off to Alex to wrap up. Alex?
Thank you.
Can
Hi.
I
How you?
just ask very quickly, Ellie, can you please put in the chat the name of your mom? That you'll see a question for you in the chat there. Okay, sorry.
That's all right. All right. Hello. Thank you for coming this morning. My name is Alessandro, and so my job today is just to mention, just before I wrap up, that if you have any questions, like I mentioned at the end of the call, just put your name in the chat, and just go sign those questions. So my job is just to basically wrap up what we've heard today, and for every single family who has spoken today, there are literally hundreds and hundreds of other families who couldn't make it on the call today because they're still grieving. Some of them were devastated. Some of them couldn't even talk about what's happening to their loved ones. And so I want to thank every family member because of your courage and strength to speak. And for every single senior that goes into long-term care, the life expectancy is about 1.5 years. So that means that Doug Ford promised to fix things in 2024. That means that 78,000 people, or that means the current people, the current generation of people that are in long-term care are not going to live to see those changes. So you're actually calculating quite a bit of death that's going to be taking place in the next few years, but it's not just the death of the seniors. It's the death of their children that are having to pick up the pieces, their grandchildren that are going to have to live with it, relatives, neighbors, and friends. The catastrophic devastation that's taking place, not just from the resident dying, but from the ripple effect of that, is never going to be repaired. So for every family, you can add 10 people in what we would call their circle of influence. It's unacceptable what's going on. So I just want to also say that Doug Ford says he's on the phone for morning tonight. He gets up early and he's on the phone till 2, 3 in the morning sometimes. Well, guess what, Mr. Ford? Over the last few years, these groups have grown to be thousands of families. And guess what? We get calls from morning to night, into the morning, up to 2, 3 in the morning. We don't feel sorry for you. So stop using that nonsense that you're on the phone till 2:30 in the morning, because we're on the phone. Sometimes we don't get to sleep all night because we're listening to families that are going through this. And there are families that couldn't be on the call today because they couldn't find the strength to talk about it. Where's that iron ring that you promised? An iron ring. That's the biggest joke we've ever heard. I want to just mention one more thing. The first wave was terrible in long-term care. The second wave is even worse. So what are you doing? What are you waiting for? And the last thing I want to mention is this, that you ran a bill 218 through in 28 days to protect corporations and for-profit homes. You ran it through in 28 days. And meanwhile, we've got a bill 13, the Time to Care Act, that's been sitting for years. And you still haven't got a plan when you're going to go take it to the third reading, and it has to pass royal assent. I mean, we're talking about years before these seniors get any remedy or relief. So I'm going to read quickly what we're demanding here today. So we demand as families accountability, transparency, and a approach to the care of vulnerable seniors and adults, specifically with the following: to pass Bill 13, Time to Care Act, and Bill 203, More Than a Visitor Act, immediately. More delays. Number 2, stabilize staffing by ending the reliance on part-time and casual labor and establishing full-time employment with benefits and sick leave in order to ensure there's enough staff to provide a minimum standard of 4 hours of care. Nowhere waiting till 2024. Abolish Bill 195 completely which allows long-term care homes to deploy untrained staff to any position they find reasonable. Are you seriously thinking that that's acceptable? You must think you're talking to children, Doug Ford. You're talking to families that have elected you. End for-profit model of long-term care, because every dollar in profit is at the expense of resident care. Until the for-profits are phased out, they must be held accountable for repeated violations of the Long-Term Care Act. Repeated violations. Inspections need to come with immediate and meaningful consequences. There are no consequences for these homes, and that's because you're allowing it. Full transparency, financial, staffing, and actual death numbers for each long-term care home, including monies recovered from any allocated envelope. Mr. Ford, you and your government have failed the most vulnerable members of our communities. We, the families of long-term care, are here today, are frustrated by the total lack of action to address the crisis in long-term care. We do not want any more empty promises. Take action now. Our seniors deserve humane care. Thank you. Any questions, type them up, or just indicate your media outlet and your name, and Jessica will allocate those.
Thank you, Alex. Ali, were you able to reply about which home your mom was in?
Jessica, Abigail from Global is waiting to ask a question.
Oh, I don't see.
Yeah, so Abigail, please go
Hi
ahead.
there. I have a couple of questions. If I could ask for Amy first, and thank you for all of you for sharing your experiences and your time. Amy, first of all, just a technical question. Your name is spelled differently on the press release, your last name, than on your screen. If you could let me know the proper spelling of your last name and also what city you are in. But my question in terms of your role as a PSW, we heard a lot in the first wave about things that homes were doing to stop this from happening again, to prepare for a second wave. I'm wondering if you can tell me what you think had been done, or was the home that you're working in doing anything differently to prepare for the second wave, and how did that go?
Okay, so the last name is Ayers.
Thank you.
I'm gonna say it's Ottawa Valley. I'm not gonna get specific into my home per se where I work. I think it's all in general, all long-term care homes. So I think what may have worked better is definitely having the Bill 13 in place moons ago. This would have had more people on the floor and more adequately able to care and give the needs that many residents were definitely lacking, for sure. So more bodies on the floor.
And Amy, I understand from the press release that you had COVID-19 yourself. Can you talk a bit about that and whether you're concerned about getting it again, since we don't really know too much about, how long it could take?
Yeah. So I'm fortunate to catch it at the very beginning, before we were classified, I guess you want to call it, as COVID outbreak. It was about 3 days later that we were told we were COVID, and I came down with symptoms 2 days after that. So it was kind of, there was no defense for myself. Yeah. And I apologize, I forget your other question.
Oh, just being on the front lines and not knowing fully whether it's possible to contract the virus again. I'm just wondering if you're worried for yourself since you're still on the
100%. It's always there. We're carrying it on our shoulders every day when we go to work. Yeah, yeah.
Thank you.
Touchy subject.
So we have a question now from Mike Lee from the North Bay Nugget.
Hi there. Yes, I have a couple of questions for Natalie. I'm just wondering if it would be possible to get an update on the complaint to the Office of the Integrity Commissioner that was made earlier this week.
Okay, sorry. We're just sort of supporting this press conference. It's really a press conference by the family groups. But Michael, we haven't figured out exactly how we're going to proceed on that. But I will contact you directly once we figure it out. We're just we have to testify before the commission on Monday. So we're going to do that, and then we're going to figure out exactly how we're going to proceed with the complaint to the Integrity Commissioner. We will proceed, just we're not sure how to do it yet. Sorry.
Okay, so we have a question from Elizabeth to Roseanne about which home your mother is in. Roseanne?
Sorry, yes, my mother is in Starwood, Extended Care Starwood here in Ottawa. Which
right
was,
now they have how many outbreaks?
It basically, the last update was there was 134 residents that had been affected by it. They have a lot of resolves. The numbers have gone up dramatically, which is a great thing. But I mean, it's also been since September 24th, and we're now what, November the 20th today, is it? I'm losing count of time here too, because my brain is just sort of fragmented all over the place. But yeah, the numbers are going up. The resolves are going up. The resolves for staff, they had 48 staff affected at one point, and the numbers there are resolving as well. But I mean, my mother tested late in, she just got her COVID positive test on Saturday, and that was this is at the end of this outbreak. So to me, this is worrisome. I mean, if protocols are in place and we're doing what we should be doing, I mean, how does this happen? It boggles my brain. I don't understand it. And I want somebody to answer those questions. I want somebody to tell us how this happens at this particular point in time.
Can I ask you, Roseanne, you said your mother was in a room with a COVID positive patient for 48 hours.
Yeah.
Have you asked about how that happened? Did they realize the person was COVID positive?
Yes, they got they were tested on the Thursday, and the results came back on Friday, and her roommate was positive, and my mother's was negative at that point. So, to leave her, a 104-year-old, in the room with a positive person, we as a family want answers. I don't understand it. It's not like there wasn't a lack of space there, because they did have space. They could have moved one or the other and separated them immediately. I don't know when my mother picked up the virus, and somewhere between the Thursday and the following Thursday's testing again, because it was the following Thursday's testing that she was positive. So,
and have you asked?
I have asked.
You asked for, and do you have an answer?
It wasn't a clear answer. It wasn't what I really wanted to hear. I wanted somebody in authority to come back and tell me that, she was left there for a reason. Whatever the reason was, I want somebody to be accountable for it. They're saying, well, it was IPAC. It was, it was Ottawa Public Health. Well, you know what? Who plays God here? Who decides who lives and who dies? Somebody might have just signed my mother's death certificate, and they will pay. I won't let go. I will not let go of this.
So, to be clear, in response to your question was to Starwood, and they said it wasn't us, it was Ottawa Public Health.
Well, I asked Starwood, I asked the administrator, and pointedly too, like I said, why was she left there? When are you moving her? Get her out of there. And she's going to be moved today. This was on the Sunday. She's going to be moved today. Well, that's 48 hours later. You've already known for 48 hours. So where's the thought process here? It's like putting somebody with the bubonic plague beside somebody who doesn't have it. You just wouldn't do it. I don't understand. But she was sort of schluffing it off to Ottawa Public Health and this IPAC team. And when they brought you a difference, because it was already rampant in there. I mean, it really affected. They lost 23 people. Okay, 23 vital lives we're lost to this. You know, so like a lot of questions to be asked and a lot of questions to be answered.
Okay. And you, just one last thing, you said you made the point that your mother's positive came at the end of this, when the hospital has gone in, when public health is in. Does that surprise you?
That actually shocked me. I mean, I really thought that, you know, the numbers were going up, the results were going up. So I thought, okay, she's tough and she's really going to not be affected by it. But, you know, it was like somebody punched me in the stomach. I mean, you know, when she called, I saw the number come up on the phone and my heart went in my throat. You know, like you just, I don't understand it at this particular point. It's at the end of this COVID breakout. I mean, we've been in the COVID breakout since September 24th, you know, like this was just last Saturday that she called me and told me that. So yeah, it was a devastating blow, especially, you know, her age. I mean, I understand she's old, she's had a good long life, but you know, she's tough. She is tough, but even the tough have to go at some point in time, but not like this.
Yeah.
Not for
And she's okay so far?
So far, she's asymptomatic. We're just having a bit of problems with her the oxygen level and that, but she really is kind of going, she's off food completely now, and I'm having trouble. Yesterday, I had major problems getting her to drink. She just didn't want to drink. She doesn't want to engage anymore. And my mother was pretty vibrant 9 months ago, you know, like, you know, and I mean, in all through the breakout, I was at her window every day, twice a day. You know, thunderstorms.
Yeah.
Thunderstorms, and you know, like it didn't matter. I stood there and I entertained her. I do my silly jigs out front and make her laugh, and you know. But I mean, she's probably just giving up now. I think. I mean, that's how I feel in my heart, anyway. Anyway, there's no reason. I don't understand it. Somebody has to explain this. Somebody in authority has to explain the reason for leaving my mother in that room. Somebody has to. And I will get an answer, but I you know, the problem is, you know, the channels to take to get somebody who can answer that question. I'm hoping you guys are going to help.
Okay, thank you. Yeah, now I will be back in touch with you. But yeah,
thank you.
Thanks.
So we had one question. I'm not sure if Ellie got to answer. It was how many times you've seen your mom this summer, and that was from Elizabeth. Yes. She's still here, Ellie?
Yeah. Can you hear me? Oh, okay. So the question is, how many times did I see my mom over the summer? Very few times. Very few, maybe 2 or 3 visits at the most over the summer, outdoors, and it was a very unpleasant experience. They had staff walking around the tables in the outdoor area, watching your every move. It was kind of like they were not staff. They were acting as guards, actually, making sure you didn't step 1 inch too close to your mother, making sure your mask was pulled way up onto your nose, which I understand, but for closely being watched.
So Abigail's asking if it's okay with Rose if they publish some photos of your mom on the ones that are on your Facebook page. Is that okay, Rose? Roseanne?
Sorry, yes, yeah, no, I don't have a problem with that.
Thank you.
You're welcome.
So if that's all the questions, I believe that I've been answered. If anybody else has any other questions, please put them down there so I can see them, but I don't see any more. So I'm going to just pass it off to Alex to quickly wrap it up. And thank you all for being here today. We really appreciate your time. Thank you.
Okay, that ends our press conference. Thanks so much for coming. If you need to get a hold of anybody, I hope you have all the information on the paperwork that emails that we sent you. And again, thank you to all the press and thanks to all the families. You guys were strong, courageous, and difficult to listen to some of that, but our hearts go out to all the families, our support to all the families, and thanks to all the media for coming today. Thank you.